Welcome to the podcast, How to Be Well and Strong. I'm your host, Jacqueline Genova, and I'm excited to have you join me as I speak with some of the leading figures in the fields of wellness, integrative medicine, and mental health, as we discover what it truly means to be well and strong in both body and mind. Get ready to be empowered, inspired, and motivated about being an advocate for your own health. Welcome back to another episode of the show, everyone. I am incredibly excited to be speaking with Dr. Lucas Timms today. Originally from Northwest Arkansas, Dr. Timms is an expert in naturopathic oncology and integrative cancer care. He specializes in IV vitamin C, mistletoe, ozone therapy, the immune system, and more. In addition to patient care, Dr. Lucas enjoys doing research, teaching, and writing for medical journals, and is a member of the Oncology Association of Naturopathic Physicians and the Society for Integrative Oncology. Dr. Lucas, I've been a fan of your work for quite some time now, and I'm just truly grateful for all of the incredible contributions you've made to the integrative oncology space, and I'm very excited to have you on the show, so welcome.
Thanks, Jacqueline. Thanks for having me. Excited to be here with you today.
To be honest with you, it took me a while to really hone in on one subject area because there is just so much I want to ask you, and hopefully we'll be able to do some future episodes. But for the purposes of this show, I'd like to discuss the topic of high-dose intravenous vitamin C, which I know is one of your specialties.
Yeah. IV vitamin C has been an important therapy in the integrative oncology, naturopathic oncology space. Probably the most common therapy that patients will seek out, and the most common therapy that providers working in this space will sort of highlight as one of the main treatments that can help patients, because it does so many wonderful things, and it's a very safe therapy, which is nice too. So
yep, wonderful. And yeah, this is a therapy too that I've become very passionate about, particularly as my mom started doing it not too long ago. But before we dive in, my understanding is that it was your wife's cancer diagnosis many years ago that really served as, I guess you could call it, the catalyst for your entering the integrative oncology space. Mm-hmm. Can you share a bit more about that?
Kind of the short elevator speech that I give people is that, I'm a doctor that just happened to come across falling in love with a woman when I was in medical school, and she just happened to shortly after that get diagnosed with cancer. And that sort of set me on a path going through that journey with her. It opened my eyes to, a lot of the problems with the cancer model that we have now in this country, and the shortcomings of that. And really, lit a fire under me in terms of focusing my career from that point forward on the integrative oncology space and helping patients navigate and bridge the gap between conventional medicine and the best of what sort of the natural alternative cancer therapies are out there.
Yeah, it's truly such a journey. I mean, just over the past 5 years, I've learned so much about the space of naturopathic oncology. The more I learn, I feel like the less I know. And in fact, I feel like the truth is essentially the opposite of everything we've been told, especially in the conventional medical space. And that's why it's so important that we have figures like you to really help guide patients to discern and parse through fact from fiction.
Yeah, it's difficult. It's quite a minefield. And, once people get sort of into that journey, they pretty quickly realize that it's there's a lot of problems. But, advocating for yourself and knowing who to trust and finding people that can help you navigate the road, not only with the conventional stuff, but with the integrative stuff, it's hard. There's few and far between. There's not enough of me to really go around for how many people we have now getting diagnosed with cancer. And so there's a bit of a supply and demand problem there. But yeah, a lot of the fundamental sort of confusion is around the fact that conventional oncology is really focused on cancer being a genetic problem. And, we can talk more about how it's not a problem, but really there's not a lot of therapies that address what I like to call sort of the root causes of cancer on the conventional side. So that causes a bit of a disarray for a lot of people.
Absolutely. And I know you're a big advocate of the terrain-based approach. Again, I have a feeling we're going to be veering off a bit, but going back to the topic at hand, I'd love to start with the basics. So can you explain the mechanisms by which high-dose IVC works against cancer?
Yes. So rewinding back to, the 60s and 70s, we kind of really start to hear about IV vitamin C as a therapy for cancer with a gentleman named Linus Pauling. And Linus Pauling is a two-time Nobel Prize winner in chemistry, not for his work on vitamin C, but for works on other things. But really, his sort of legacy was around IV vitamin C, working with several other orthomolecular doctors at that time, and starting to really figure out, like, how is this working? Because they were seeing benefits in patients. And so the number one mechanism by which it helps with cancer is that when you give IV vitamin C to patients and you reach a certain threshold of concentration in the bloodstream, which is why you need to go real high dose, usually at least 50 grams, but sometimes up to 150 grams. But once you get up to that threshold, you start to see this effect where it's generating hydrogen peroxide in the bloodstream. And the hydrogen peroxide is actually what I like to call selectively toxic to cancer cells because it does not harm our healthy cells. One of the things that Pauling discovered through his research was that most cancer cells lack the enzyme called catalase that helps to break down excess hydrogen peroxide in and around those cells. So this is something that makes cancer cells, one of the few things that makes cancer cells different than our regular cells. And so by taking advantage of the lack of that enzyme and creating a bunch of hydrogen peroxide, which is an oxidative therapy similar to chemo, it selectively goes after cancer cells, whereas our healthy cells that have plenty of this catalase enzyme, they're not bothered by the hydrogen peroxide. They break it down into water and a hydroxyl radical, and so it's not a problem for them. So that's the main mechanism by which it helps with cancer. We've since then, over the last 50 years, there's been gradual further understanding on things that IV vitamin C do in terms of the terrain or the tumor microenvironment. We know that it decreases inflammation in and around tumor environments. We know that it can help repair some of the DNA damage that has led to the cell becoming cancerous in the first place. We know that it favorably alters the epigenetics that are involved in those cancer cells as well. And we've also found that it is highly protective for when cancer patients are going through more toxic treatments like chemotherapy and radiation, that it has both a simultaneous effect of increasing the effectiveness of those therapies while protecting the healthy cells from the collateral damage of those therapies. So as you can see, it's a very important therapy for patients in lots of different ways and in lots of different phases of their journey in terms of supporting other therapies, also addressing the underlying issues and improving the terrain and the environment around the tumors.
Yeah, no, that's truly incredible. And again, I love how it works so synergistically with all of these therapies. But going back to dosage, I've read that 50 milligrams tends to be like the quote unquote standard or most used dose. How can a patient determine the therapeutic dose for them? And I know my mom's naturopathic oncologist had said, if you take your blood sugar immediately after, if it's between like 350 to 400 milligrams per deciliter, then you know you're in the therapeutic state. Is that, I guess, the best way to determine what dosage should be?
That's one of the ways. Yeah, this is an important topic because I think this is one that a lot of patients don't understand, or when they start to go look for places that do IV vitamin C, it's, a lot of these clinics, they're just giving a standard dose, like you said, a 50-gram dose, or, if they're more advanced, they'll say, okay, well, we recommend 75 for you, but they're not actually personalizing those doses, which is what you need, because 50 grams is probably, you said, that's kind of like the industry standard. I would call it the minimum in terms of what we would consider a high dose or an appropriate dose for a patient with cancer. Lower doses can have benefits, but you're really not creating that hydrogen peroxide effect before you get to about 50 grams. And some people you need much higher. How do you determine what your dose is? couple of options. One is, well, the gold standard really should be a blood test where you're immediately after the infusion, someone's, a nurse is drawing the blood, and you're running a test to look for how much vitamin C is in the bloodstream. Okay. So that's the industry standard. The problem is not a lot of clinics have the ability to run a test like that on site. Okay. They don't have the machinery. You need a HPLC throughput system in order to run a vitamin C assay like that. And so not a lot of places do that. So we've found sort of a surrogate, if you will, that works pretty close to that. It doesn't give you quite the pinpoint accuracy as an HPLC blood test, but what a lot of the clinics have resorted to, just because it's easy and convenient, is checking blood sugar levels. Why do we check blood sugar levels? Well, it just so happens that the ascorbic acid molecule, from a chemistry standpoint, is almost identical to the glucose molecule. Okay. There's only one methyl group that's really changed. And we can go off on a tangent in the fact that most animals besides humans synthesize their own vitamin C internally from glucose. Because again, it's just one enzymatic reaction to make your own vitamin C. But humans, throughout our evolutionary process, lost the ability to make our own vitamin C. So just kind of an interesting factoid. But back to the testing, the glucometers, the little finger prick blood sugar testers that you can buy at Walgreens for $15, they get fooled. They think the vitamin C is glucose, okay? Because they can't really differentiate from a chemical standpoint the two molecules. So what you said is true. If you test the glucose before the IV, let the vitamin C IV run, and then immediately test it afterwards, the delta of those two numbers, or the difference of those two numbers, is essentially giving you the vitamin C concentration in the bloodstream. And you nailed it. Your goal for that is that 350 to 450 range. So a pretty round number example would be if your blood sugar is 100 before you start and it's 500 after you start, your vitamin C level is 400. 500 minus 100. Okay. So target dose, you want it between 350 and 450. So that would be, if someone did that at 50 grams, they had a difference of 400, we'd say, okay, you're in therapeutic range at 50 grams. But let's say they tested it was 100 before and only 350 afterwards. Okay, that's a difference of 250. You got to go up. So we would titrate them up to a 75 gram, do the test again. If they're in range, great, we keep them there. If they're still low, we'd go up to 100. We kind of go up in 15 to 25 gram increments until we get them into that therapeutic range. And there's no real, there are some rules of thumb when it comes to dosing. Smaller individuals are usually going to need a lower dose. Individuals with a lower disease burden and lower inflammation levels are usually going to need a lower dose. But you really should be testing every patient and not just guessing. And even if you don't have access to the blood testing, at the very least, you should be doing the glucometer test, because it only takes a second and there's no cost to it, really.
That's great to know. And going back, I guess, to frequency of the therapy, right? And I'm sure this is going to vary across individual patients, but in your clinic, how often would you administer IVC?
I would say the kind of gold standard for frequency would be twice a week, up to potentially 3 to 4 times a week. But I would say most people were starting them out at twice a week, see how they're responding to it, and then adjusting up or down from there. Obviously, it's a lot easier if patients have a port placed, because any kind of IV, even IV vitamin C, over time, that many pokes and sticks, it can kind of cause some trauma in those veins. And so if they have a port placed, we can usually do it a little more frequently if needed. But if you're just doing a peripheral vein, if you're doing it more than twice a week for a while, it's going to catch up to you a little bit.
Yeah.
It also depends on what other therapies they're doing. We're usually never just doing IV vitamin C alone. We have other things, potentially other IV therapies that we're mixing and matching with it.
Yeah. And also too, what are your thoughts on taking liposomal vitamin C orally? And how does that
Mhm.
differ from IV administration? So I recall reading somewhere too that someone had said, I can't remember the correct dosage, but it was like X amount of
Mhm.
liposomal vitamin C is equivalent to IVC. Do you
Yeah.
agree, disagree? Why?
Yeah, I disagree emphatically. So just some reference points here. So even with liposomal, everyone just walking around, like unless you have, literally have scurvy, your vitamin C level in your bloodstream is going to be somewhere between 1 and 3 milligrams per deciliter. Okay. That's just like a normal kind of resting average level in the bloodstream. If you were to take, just a bucket full of liposomal vitamin C all in one day, like let's say you go crazy. Let's say you take 50,000 milligrams of liposomal vitamin C. About about the highest you're ever going to get your bloodstream levels is maybe to 10 milligrams per deciliter. Okay. Now, if you remember what I said about the IV levels, how high are we getting those? 350 to 450. Okay.
Wow.
So people, usually it's people who are trying to sell you the liposomal stuff that are saying, oh, yeah, this is just as good as the IV. Physiologically, it just doesn't work that way. Anything you're consuming orally has to go through the gut barrier, kind of absorption pathway, and your body gets saturated, and it only allows so much in it at a time. And one of the keys to getting your blood levels that high is not only the dose, but it's also how quickly you're pushing that into it. And so, you consume a bunch of oral vitamin C, whether it's liposomal or other kinds, and it's not all going to flood into the bloodstream all at once like it would through an IV. Okay, so you're never really going to approach even close to come. You're not going to even come close to approaching those levels where you would create hydrogen peroxide effect and an oxidative effect that would kill cancer cells. Now, there's still other benefits to taking oral vitamin C. Okay, and I do like liposomal vitamin C. When I have my patients on their non-IVC days take 4 to 6 grams of liposomal vitamin C. It is superior in its absorption in terms of getting through that gut barrier, getting into the lymphatics as well, and it has better uptake amongst your immune cells. So it is going to have benefits that way, but it's not going to create that hydrogen peroxide effect that kills cancer cells.
Yeah, that makes sense. And I know Dr. Thomas Lodi also has this like protocol where a patient sips liposomal vitamin C throughout the day. I think it's called like the 7-sip-7. But is there a reason that you wouldn't have a patient take liposomal the day they have high dose IVC? Like, is there such a thing as too much IVC?
Um, no, it's not too much. I just feel like when we're creating that high of a level in patients, I almost kind of see it like a waste.
Yeah.
It's like, do that on your non IV days because we're saturating you as much as we can, your whole body with the IV that day. And the liposomal stuff isn't cheap. So I'm like, save that for your non IV days. It's not going to harm it, but yeah, that's kind of the reasoning there. I mean, if they want to sip it throughout the day, no problem. But to me, it's kind of redundant on those IV days.
Yeah, no, that makes sense. And certainly as I started exploring this therapy for my mom, I really got into the weeds and read that the sourcing of the vitamin C is incredibly important
Mm.
and that it shouldn't be corn based, but rather sourced from yams. And I feel like this is an area not many people touch on. So, how can
Hmm.
patients navigate properly choosing a supplier or at least ensure that the clinic they're going to is getting a good quality of vitamin C?
Yeah, that's a great point, Jacqueline. It used to be a bigger issue. Thankfully, a lot of the vitamin C injectables have phased out any sort of corn-based products. 90% of corn in our country is GMO and
Exactly.
Roundup ready. So, obviously you can understand why we'd want to avoid that as a source of the vitamin C. So yeah, that brings into play other sources like yams, beets, tapioca. So yeah, I mean, always ask. I mean, be an informed consumer out there when you're looking at these clinics. It's going to be few and far between the ones that aren't using or that are still using a corn-based product. I'm not even aware of any commercially based products that are corn based. So if they are, it means they're probably getting it made individually through a compounding pharmacy, but they should know better. But doesn't hurt to go ahead and ask and make sure that they're using something besides corn.
Yeah, that's good to hear. And for those patients who maybe aren't near a center or who live on the East Coast, like my mom in New Jersey, where it's difficult to find practitioners who do these therapies, what advice could you offer them in finding someone? Because I know it was so difficult in finding a clinic just to have my mom go and do it at.
Yeah, it's tough. I do telemedicine. I work with patients all over the country. And one of the things that I do with a lot of patients is help them identify, IV services in their area that are good, reputable, and I can communicate with those clinics and make sure that patients are getting proper doses and formulas and kind of do that for them. So just a little bit of a self plug there, but yeah, patients can, reach out to me if they want help with that. But you can kind of you can do the Google thing and just say, okay, IV vitamin C in my area and see what comes up. There are a few professional organizations that you may also want to look through, like ACAM, ACAM, ONC-ANP. That would be for naturopathic oncologists. You can search there. Society for Integrative Oncology. Those are going to be some professional membership societies that you can do searches for people in your area, see if there are clinics. Most clinics that do integrative oncology are going to offer IV vitamin C amongst other therapies as well. But yeah, there's certainly a lot of sort of integrative oncology deserts out there still in our country, and there's these large areas of several states where it's hard to find things, and so that's patients may have to travel. They may have to drive an hour or two to a larger city to get these types of therapies, and it's unfortunate, but you got to do what you got to do.
What is the typical time frame that we could expect to see positive results in a patient?
I think just generally speaking, in terms of like when would you expect to see sort of like a response or see if it's helping or not? That can be tough to tease out, but general rule of thumb, I'd say, typically we'll start patients twice a week at a target dose for 3 months, and then 2 to 3 months, and then kind of reevaluate. The problem with some of these integrative or more alternative therapies is that you don't always see patients expect you get like a scan and like the tumors are all going to be smaller, or some of them are going to be gone, or all of a sudden they're whatever their tumor marker is that you're watching is going to go down to the normal range. In reality, it doesn't always work like that. Even when things are working, it doesn't always result in that soon. Cancer doesn't sort of start overnight, and unless you're using something really toxic, it takes time to see changes sort of evolve, even if it's in the blood work or on scans. And so patients need to understand that these therapies take a little more time than what we're used to hearing about with, say, chemo or radiation or surgery, which are, much more aggressive treatments. When we're doing things like IV vitamin C and working on the terrain and the underlying problems and trying to make these more fundamental shifts in the health of the body, those things take time. And so we can kind of, if you're watching enough different markers and you understand the different pieces of each person's puzzle, you can get an idea of like, hey, we're moving in the right direction. But in terms of like 3 months and then your cancer is going to be gone, I mean, that's not reality how it happens. Now there's kind of like one-off cases where, things that can't be explained happen, obviously, but for the majority of people, I try to, get them to exercise some caution, set up their expectations so that, they understand that this is a marathon and not a sprint. And I also try to help them understand that that's a good thing, because the longer we're running this race, the better, especially if you've got advanced stage cancer. So
you touched on a good point before. So with tumor markers, or rather with conventional oncology, right? Patients and doctors always just look to tumor markers to assess whether or not a patient's doing well on a therapy. I know that naturopathic oncologists obviously test for so many other things, right? Like CRP levels in the body. What are your 2 or 3 blood tests that again assess the terrain of the patient that are good indicators of either tumor progression or, hopefully remission?
Yeah, I would say the three categories for testing that I like to watch that I call my biomarkers are inflammation markers, of which I like what Dr. Nasha Winters refers to as the trifecta, which is high sensitivity CRP, LDH isoenzymes, and sedimentation rate. I like to look at the second category would be immune system markers. So how's the immune system working? Because again, a lot of our therapies are trying to revive or refocus the immune system in the proper way. So I like to look at nagalase. I like to look at neutrophil lymphocyte ratios. I like to look at interleukins like IL-8, and then natural killer cell activity. And then I'd say the third category would be metabolic health markers, things like hemoglobin A1C, fasting insulin, IGF-1, homocysteine, things like that. And so those would be kind of like my general panel of what I call cancer biomarkers or terrain markers that don't necessarily say, okay, well, the tumor is shrinking or growing, but it tells us more about what's going on in the soil where the problem is.
Also, too, I mean, I found that, again, tumor markers can rise because of tumor die-off, right? When the cancer cells actually begin
Exactly.
to die. So unless a patient were to undergo a scan, it's really difficult to tell, is it die-off or is the cancer growing? So those are great other indicators to definitely look at.
Yeah, so that's kind of like a situation where, and we see that all the time, where patients start a new therapy and their tumor marker all of a sudden goes up, but then all those other biomarkers are showing improvement.
Yep.
I tell them not to worry about it. I say, look, the tumor marker will come down.
Yeah.
The biomarkers are telling us that we're moving in the right direction.
Going back to IVC, I told you we're going to be veering off because there's so many things I want to ask you, but I recently came across a study that showed that doxycycline coupled with high dose
Mm-hmm.
IVC was a very powerful weapon against cancer stem cells. Are there any other complementary therapies, artemisinin, things along those lines that you would pair with IVC to make it even more effective?
Yes. Yeah. I mean, to me, if you're not doing combination therapies at this point, if you've got advanced stage cancer, or really any kind of cancer, I mean, you have to be hitting things from as many angles as possible because cancer is very, uh, it's very hard to treat. It wants to stay alive, just like your healthy cells do, and it can be quite diabolical. So yeah, you need to pull out every trick in the book if you can, and so using off-label drugs uh, to put cancer cells into a certain vulnerable state so that the IV vitamin C is more effective. You can do that with hyperthermia as well. You can do that with ozone therapy. That we stack a lot of ozone therapy with our IV vitamin C, and that kind of has a 1-2 punch as well. You mentioned artemisinin, absolutely. That's another good combo therapy with IV vitamin C. Um, High dose D, giving a patient, a 50,000 IU injection of D3 right before, especially if you've got a lot of inflammation going on in the body, that can be a synergistic therapy. Fasting, fasting is one of the things that you can do to sort of, again, create this increased susceptibility and vulnerability amongst the cancer, mainly the cancer stem cells, like you mentioned. So that things like more oxidative therapies, IV vitamin C, or even chemotherapy can be more effective.
Yeah, I was just going to ask you that. You read my mind. I mean, fasting itself is an incredible therapy, right? But that coupled with IVC, I've heard, so much more significant. What is the proper time frame for a patient to fast before IVC? Is it 24 hours? Is it 16?
So yeah, IVC fasting and IVC, it's certainly there's benefits there. You do have to be careful with some people, especially when they've got a lot of metabolic dysfunction. Because one of the things that happens with high dose vitamin C is you do get a pretty big you get a pretty big electrolyte shift in those patients, and number two, you can get a temporary hypoglycemic effect. Again, because that similarity to sugar in the bloodstream, as the vitamin C starts to get cleared, it can result in sort of the same feeling of hypoglycemia. And so some patients who are not what I would call well adapted to a fasting state yet, you need to kind of build them up to that first. So I wouldn't recommend just everybody jump into fasting with IV vitamin C. You probably want to start getting your body used to a fasting state before you do that. But let's assume that someone's well adapted to a fasting state and they've done, 2 to 3 day fasts in the past. Okay. Then I would say the optimal would be, let's say you're going to do your IV vitamin C on a Wednesday. I would say fast from Tuesday dinner to Thursday dinner. So basically a 48-hour fast around it, but only that day you're getting the IV being the full day.
Gotcha. That makes sense. And is there a particular diet that can also help to make IVC more effective? So, for example, I had Dr. Derek Guillory on the show not too long ago, and we had discussed the topic of ozone therapy. And he had mentioned that he wouldn't necessarily have cancer patients do ozone unless they were in a state of therapeutic ketosis. How does that apply to high dose IVC?
Yeah, I mean, I don't think that IVC is necessarily dependent on a certain dietary state. Obviously, there are things you can do, like I said, to increase the potential efficacy of IVC, like fasting, or you get a lot of the similar benefits of fasting in a ketogenic state as well. So ketosis and fasting, there's a lot of overlap between those two. Ketosis is a little bit, sometimes it's easier for people just to fast altogether than to try to eat a ketogenic diet because of the amount of fat that they have to consume to really get things moving that direction. So yeah, I like ketogenic diets. To me, fasting is actually a little bit easier for most people. But, with certain tumors, triple negative breast cancer, brain tumors, certain types of leukemias, I think a ketogenic diet is warranted. But, most patients need a lot of hand holding and kind of education on how to do a ketogenic diet right so that they're not just sitting around eating bacon cheeseburgers all day without the bread. So, yeah, a little bit more things that go into setting patients up for a true therapeutic ketogenic diet versus just having them not eat at all. You get a lot of the same benefits and it's easier for them.
Yeah.
But other dietary factors with vitamin C, obviously the less junk food and the less things they're eating that are creating more inflammation in the body, the more you're going to see the benefits transition or translate to anti-cancer effects versus just cleaning up other terrain problems for them.
It's such a nuanced area, right? Keto for cancer. And again, not to veer off course, but what, in your opinion, is the most optimal diet for a cancer patient? Because we do hear a lot of testimonial-based stories on the benefits of going keto for cancer. But from what I've read, while I think keto could be beneficial in the short term, it's not necessarily a good long-term strategy. And again, you touched on certain cancers like brain cancer that, has been shown to do very well with the keto diet. I chatted with Dr. Thomas Seyfried a few weeks ago, had him on the show, and he obviously has done so much research in the area on ketosis for cancer. But I don't know, what are your thoughts, reservations on that diet? And again, not to go off tangent, but my mom has been trying to get into a state of therapeutic ketosis, but it's also been to the sacrifice of plants, because anytime she consumes a lot of plant foods, that knocks her out. And we know how critical plants are, especially for someone with a hormone positive breast cancer. So
right.
How do you reconcile all of that?
Yeah, there's a lot of merit to ketogenic diet. Seyfried's work is great. Again, Dr. Winters' book, Metabolic Approach, she's a big advocate for a ketogenic diet. I think there's a time and a place for it, especially when cancer is in a true growth phase, and you're really kind of needing to hit it hard. Then ketogenic diets, or if there's brain tumors involved, specifically brain tumors, there's a lot of good evidence for those. But yeah, like you said, Jack, I mean, it's not a very sustainable diet for most people. I think it's a source of stress, but it's also, it's an exclusionary diet. So you kind of cut out a lot of things that could also be providing some additional benefit, like a lot of the plant foods. And so there can be a balance, I think, with it. And some people, take to a ketogenic diet a lot easier than others. And so for them, it's fine. But, if you've got someone who's already malnourished, if you've got someone who has got a lot of gut problems and toxicity issues, that's the kind of patient where I would be hesitant to throw them into a ketogenic diet. So you really got to look at the whole picture, and the diet thing. Unfortunately, there is no one size fits all when it comes to diet and cancer. I would say the only true common denominators are avoid junk food, highly processed foods. Everyone knows what I mean when I say that, and avoid refined and added sugars, and try to eat as organic as possible. Those are really the only, I would say, true like set in stone recommendations. Beyond that, I think you need to look at the patient. What's their terrain look like? What are the root causes for their cancer? What type of condition are they in? What other therapies are they doing? I see that, the diet is a therapy, just like IV vitamin C or ozone or whatever. And so how does it fit in with the other therapies and what the goals are for that patient? So I know that's probably not the answer you wanted, but in reality, it's just not as simple as saying, okay, everyone do a ketogenic diet.
Yeah, no, I couldn't agree more with you there. And again, I also spoke with Jen Nolan from Remission Nutrition not too long ago, and I love her, her paradigm of test. I mean, it's Dr. Nacia Winters, but test and assess,
Yeah.
right? And everyone's different.
Yes.
So do something new, see how your body responds, and work from there.
Exactly.
But no, couldn't agree more with you. Well, Dr. Lucas, I want to be conscious of your time. You're a very busy man. I'm very appreciative of all of this. I'm so excited to share it with listeners. Where can they find you?
Yeah. For people wanting to become a patient, I would say check out my website, which is drlucas.org. Doctor is spelled out. So DOCTOR, lucas.org. And you can request a telemedicine visit through there. I'm also pretty active on Instagram at Dr. Lucas. Again, doctor spelled out. That's about it. I don't have like a YouTube channel or anything. I don't have a podcast, but I've got a lot of other podcasts that are out there on the internet that you can probably find me through that I've done. But yeah, website or Instagram are probably the best places for people to find me.
Wonderful. And I will include the links to both of those in the show notes. But my last question for you, and I love to pose this question to all of my interviewees, is what does being well and strong mean to you?
Well and strong, because that's the name of your podcast.
Exactly.
Okay. Well, what does it mean to you? I hate to answer a question with a question, but like, where did that come from for you? I don't know too much about your background, so.
Yeah, no, absolutely. I know I probably should have prefaced this in the beginning of the show, but my mom was diagnosed with breast cancer a few years ago, and Well and Strong really just started as a means for me to publish the research I was doing for her from a complementary standpoint and share with readers. And then little by little, it just grew from there. And throughout that journey, and even till today, I've just really, focused on the importance of your mental health, right, and being well. So when I was coming up with the name, I thought well and strong, being well and strong in both body and mind, right? Because healing has so many other aspects to it beyond just the physical. And I know you shared a lot on the importance of emotional health in that process. So I would say it's really just being at peace and healthy, again, in both your mind and your body, and certainly spiritually as well.
Yeah, no, that's great. I most people that are in this space have a personal story, right? Whether it's them, a loved one, mom, dad, wife, spouse, whatever. And so kudos to you for taking up that torch and making this a passion. I agree. I think what you said is great. I mean, well and strong, those are great words. Those are great descriptors of sort of how we all want to feel, right? I think when we feel good and we feel strong in our bodies and our minds, then we're probably going to be the best versions of ourselves and probably be the most impactful that we can on our society in a healthy way. So, yeah, I think those two things lead to us having the best expression of our being here on Earth. So I agree with you. I like the descriptors.
Dr. Lucas, thank you so much. I look forward to having you on again. And again, just truly appreciate everything you do in this space.
My pleasure. Let's do it again.
I hope you enjoyed this episode. If you would like to support the show, please subscribe, leave a rating, and share it with others. Be sure to visit wellandstrong.com to access notes from the show and to stay current with new content. I'm so grateful you joined me. Be well and be strong.